But I think one of the things that will help us get back to normal is recognizing that people coped throughout this the best way they could. And if we can try not to be too judgmental or too angry, because some people get angry, that that might help with the transition back to whatever comes next.
Hello, I am Celia Sanka, Executive Director of the DiversityCanada Foundation, and this is the Golden Voices GoldenYears Fireside Chat. This is where we focus on issues that are of importance to seniors. We've had discussions with seniors over the previous weeks on the subject we'll be focusing on for the next hour or so, and we also do have senior representation in our online audience for this Fireside Chat. Today we have as our guest Shelley Watt Pro. Did I get that correct, Shelley?
Yeah.
Thank you so much. Shelley is the Executive Director of the Counselling Center of East Algoma, and she's here today to give us some insights on a very important aspect of our lives as we have gone through the pandemic, and we are still going through what we hope is the tail end of it, and that is our mental health. We'll be looking at issues such as how the pandemic and crises, major traumatic events like the global COVID-19 pandemic, how these sort of situations affect our mental health and how we can cope with it, and various issues around that. We'll also spend some time speaking with Shelley about the services offered by the Counselling Center of East Algoma, because they have a number of programs that seniors in our community, everyone of every age, can access, but we're focusing on seniors today. So thank you very much, Shelley, for taking time out of your schedule to be with us and to share these insights with seniors.
Thank you so much.
Okay, wonderful. So we're focusing first of all on the pandemic and mental health issues associated with it. It's been so over a year that we've been under stress and strain of having our entire lives turned upside down. What can you say about how the pandemic has affected people's mental health?
Well, Celia, certainly we have seen over the course of the pandemic folks struggling as a result. So life and the stressors we have in life never stopped, right? So the pandemic is really just another layer of challenge for people who may already have challenges, whether it's health challenges or isolation, financial challenges, whatever it may be. The pandemic has just complicated things, I find. So we certainly have continued to offer service all the way through. We had a period of time that was, I like to call it, eerily quiet at the beginning of the pandemic. And I think folks were just in a sort of wait and hold position. People were saying, no, originally it was 2 weeks, right? We'll stay home for 2 weeks and this will pass. So a lot of our clients just were quiet. Call us when it's done. We'll get back into service. And then, of course, as the 2 weeks turned to a month, turned to 2 months, then people were starting to reach out again and say, okay, so I get that I might have to do my service by phone, but I want my service. So we have seen a real shift in what people are requesting, and I think we all struggle, and the pandemic, like I said, has just been an extra layer of challenge for people.
In terms of speaking with seniors, we had some discussions with small groups as well as individual seniors, and what was troubling for many about the pandemic is the uncertainty that it brought. And that was something that many found difficult. That was, for many, the most difficult thing, not knowing what the next day will bring, not being able to plan, and your normal thing, like tomorrow I will go to the pool and get my exercise, and then the next day I will meet up with my friends and ensure that I have those sorts of interactions that will give me a sense of who I am.
Yeah.
By these connections. So in terms of coping with the uncertainty, what would you say are some of the strategies that not only seniors but we all can turn to ensure that we maintain a sense of who we are and where we stand in the world?
I think that's a great question, because what uncertainty does, regardless of the cause, is it throws everything off, and it makes us feel like we're out of control, which we are. We're no longer able to go to the pool, like you said, or meet up with our friends at McDonald's for coffee. We have some limitations on us. And when we feel that we have no control, one of the best strategies is to take back control where you can. So yes, you may have to stay home, but is there some exercise you could do at home? So you don't have to fully give up everything. You try to take back what you can. When I was referring to the special challenges of Elliott Lake, certainly many seniors came here with an idea of what they wanted, right? I'm an active senior, I'm going to go hiking, I'm going to join this club or that club, and maybe even travel. Several seniors leave town for the winter months, right? Which you couldn't do last year. So all of those things can really make you start to think about, this isn't the life that I chose. The other thing about Elliott Lake, and I don't know if the people online find it, but I find a lot of folks expect us to go visit and they don't come to visit the same way. Now the pandemic put another spin on that, because even if you did have family that wanted to come visit, there's a reluctance to have that. So there were a lot of stops and starts in the last year that I think perpetuated that sense of uncertainty that you were talking about. Last summer we kind of felt like we were going to be okay again. School started, life got back to sort of normal, although we're still wearing our masks, right? But, and then it stopped again. And then we crept into something again, and then it stopped again. And those stops and starts, I think, are another complicating factor for coping strategies and doing the things that you typically do. The other thing I might mention that I think has been an additional challenge is, for a lot of people, once they retreated home and did what they were supposed to do, right? Stay home, stay safe. There's a fear about going back out again. So even now, when you can possibly go get your own groceries, I'm aware that there's a segment of the population that have a real apprehension. And part of that is because you've gotten into this routine of being alone and, having things brought to you or greeting folks at the door. So once you do something for a while, they say it takes 3 weeks to create a habit. We've been in this far longer than 3 weeks. So it would be understandable that when you've been doing something a certain way for the last year and a half, that it would seem odd to get back to what your normal life was. So I think maybe just having the awareness of some of that as well, that if you are apprehensive about going back out, there's other people who have that too. It's a normal reaction after you've lived through an abnormal event. Those are just some of the things I can think of.
Thank you very much for that, Shelley. That's really interesting. And I can absolutely see that having got into our retreated into our own little bubble, and even total isolation in some cases. It may have become comfortable, or what we know, and to open back up again.
Absolutely.
That's so the tail end of the pandemic brings its own challenges of readjusting to the world that we knew before.
I think there's another thing too in terms of, there are some folks who have been very compliant with all of the rules and regulations. Other folks have been less compliant. And it's easy on both sides to be critical of the other side. But I think one of the things that will help us get back to normal is recognizing that people coped throughout this the best way they could. And if we can try not to be too judgmental or too angry, because some people get angry, that might help with the transition back to whatever comes next as well, rather than, venturing back into social situations and then being really critical or not understanding of the people who may be there with you.
Another area I wanted to look at when we're looking at our mental health in a crisis situation like this, where things are topsy-turvy, it's really not normal. How can we gauge what's healthy and what's unhealthy thinking, behaviors, attitudes in these extraordinary times?
So I think being aware of the extremes is important. So if you're sleeping too much or not sleeping enough, if you're eating too much, not eating enough, drinking more than you used to, not drinking. And I really rely heavily on people's own sense of themselves. Most of us really know when something is off. And the other piece would be the duration of that, right? So anyone can have a weekend where they eat or drink too much, for example, and maybe don't sleep as much as they wanted to. But most people will come back to the equilibrium by the Tuesday, or, you've caught up on your sleep and you're back to eating a little healthier. So you would want to pay attention to how long the behaviors are going on and really trust your instincts. If something feels off, it probably is. The other thing I would suggest, because you mentioned the isolation earlier, so sometimes that can throw you a little bit because you don't have feedback. It's really nice when you're around your friends, because sometimes your friends point out to you before you recognize it when something is off. So if you're still in communication with people you trust, friends or family, and if they're noticing things and pointing it out to you, it's probably worth paying attention to. So the other thing I would say is, if on any day, I don't think you need to be really off one way or the other. If you could benefit from a check-in with somebody, call. There are peer support lines, there are senior specific lines, we have a crisis service. So we're certainly available to just chat and talk something through with someone if they would think that would be helpful.
That's great. That's great that seniors and everyone in our community have the Counselling Center of East Algoma as a resource that we can turn to. You mentioned certain specific things that we can look for as signs of, maybe we are not where we should be. In terms of these two specific things, diet and exercise, how can changes that we make in those areas of our life affect our mental health overall?
Actually, that's such a good point, and I feel so fortunate that we live in Elliott Lake, because if you have mobility, we certainly have had the options to be outside, right? So we know, actually, it's one of the first things we talk to people about if their mood is low or if they're feeling depressed. We know that if you get a reasonable night's sleep, if you eat 3 meals of pretty good food, so I'm not saying 3 times at McDonald's or 3 boxes of cut dinner, you have a reasonably decent meal, and if you get some exercise, we know that those 3 things over time elevate your mood for sure. So regardless of medication, regardless of anything else you do, if you can maintain some stability in those three areas, your mood will be better than if you weren't doing that. We know that for sure.
Okay, and that's great news for Elliott Lake seniors because, as you mentioned, we're here in the jewel of the wilderness. And, unlike the big cities where people have to travel maybe an hour, half an hour in order to get some access to a lake or fresh air or beautiful forest scenery, we have it 2 minutes outside our back door.
We certainly do, and I think Mother Nature helped us out a little bit this winter too, because it certainly wasn't as harsh as other years we've had. But again, I know many seniors worry about slipping and falling if there's ice or snow. So that can be an additional barrier to getting out and doing something. But if you have the capacity to get out, like you mentioned, we're not in Toronto, where if you're walking down the sidewalk, you're meeting 500,000 people coming at you. We've been really fortunate to be able to access even just a walk on your street, standing in your parking lot and possibly waving to someone, So I feel like that's a real gift. Another gift of being in Elliott Lake is that we do have that space. And now that the weather's more beautiful, like you said, there's lakes everywhere. The only problem now is the bugs.
Yes, a perennial problem. Yes. Okay, so one of the things that came up in our discussions with individuals and with our small groups is different people have been affected by the pandemic differently, some more so than others. And the question was, how do you reach out to someone who has been angry or depressed or who has been terribly affected by the restrictions that we've had to face? How do you offer support to someone who's struggling because of the isolation?
That can be hard sometimes, yeah, because especially if the person is angry, most people will give you, a time or two and they'll be understanding of your anger. But then at some point, most people say, I got to look after myself too. And hanging around with you is not helping me either. So I think I would suggest that, first of all, make some efforts. If you can be understanding, if you can empathize with the person and their situation, that's usually a great starting point. And I think recognizing that sometimes people act like they're angry, but if you peel it back a little bit, you find out that they're really hurt or grieving or disappointed or frustrated. So oftentimes what looks like anger is not. But it's hard to sometimes peel that through and really be empathetic, especially if the level or the intensity of the anger is really out there. But I would just suggest approaching folks with concern, with an ability to help or have a listening ear. Most people will accept that and be grateful for it, even if they can't verbalize that, at least initially.
That's an excellent point, that what you may see is a flash of anger, but yes, there may be hurt that's spurring that, and they're trying to disguise the hurt.
Well, and especially if if maybe you're feeling your family's not reaching out to you the way they should, or we put a lot of shoulds and expectations on people, and usually when those expectations aren't met, that leads to hurt, disappointment, and anger. So if we can try not to expect, like I'm not really a big fan of the shoulds, right? My daughter should be calling me 3 times a day, or my son should be shoveling my driveway. Well, maybe your son is raising kids and he wants to get to your driveway, but he can't get out of his own driveway yet. You know what I mean? If you change that thought pattern to, I know my son will get here when he can, or I'm going to ask my daughter when is a good time for us to have our conversation, then you can get the need met without the hurt or the when the expectation is not met, it often leads to hurt. So if you can, again, empathy and being aware of what the other person might be going through can really go an awfully long way.
Yes, that's an important word, empathy. Okay, now a couple of questions specific to the pandemic, and each will be the flip side of the other. There have been a number of people who have been reluctant to get the vaccine. They're feeling stressed over it. And the question that we had received is how, if you are feeling hesitant about the vaccine, how do you I'll bring in the flip side of the question as well. You're feeling hesitant about the vaccine, and you're also fearful of being shamed and ostracized, either because you have not got the vaccine yet, or you, because of that fear, or have determined that you will not get the vaccine because of, various reasons. So what would you say to someone who has both the hesitancy in terms of getting the vaccine, or the determination that they will not get the vaccine, and dealing with a sense of shame or fear that they will be shamed by others if they reveal their position on the vaccine?
Well, that's almost like talking about religion, right? Sometimes it can be very polarizing. And I guess I'm back to empathy. If we can try and at least recognize that people are making the best choices for themselves with the information that they have, and trust that they're really putting some thought into that. I think where I have a challenge is when people are not doing their homework. So if you're fortunate enough to have a doctor and you have questions and concerns like you've mentioned, Celia, I would suggest have a very frank conversation with your doctor. Will this vaccine affect me and my health conditions? What might be the consequences if I do or don't? So get as much information as you, almost like buying a car. What do I need to know about this vehicle? Is it within my price point? All of that sort of thing. And you would want to do the same thing. This is your health. It's really important. And I hope that people are making those choices and decisions with really good information. Where I get fearful is when they're taking a position based on information that may not be as accurate or may not be factual. You can find any piece of research or evidence to support your position if you want to. And I think, a conversation with your medical practitioner at the beginning and the outset. And then once you really do your homework and you make a decision for you, don't really know that it's anybody else's business but yours, really. So if I've decided I've done my homework, I've had my conversations, I've used my critical thinking, I've done a pro and con list, and I've come to this conclusion, then you can run with that conclusion. Maybe be open to considering, there has been a lot of information change over this year and a half. Things that we thought we knew early on sometimes have shifted. So I would just also suggest that maybe it's not a one-shot deal, that as more evidence becomes available, you evaluate it again. It may validate your position, it may change your position, but really being open to good information and evaluating that against your values, your own personal beliefs, and your health status. And then really trust that people are doing what makes sense for them. You really have no control over someone else's body, so I don't know that it's worth getting all cranked up about.
Truly wise words, Shelley. Thank you so much for that. Okay, so we do have one comment from the audience, and this is from Ron, and he says, I find meditation and journaling helpful in coping with this pandemic specifically and my well-being in general. I also have a number of hobbies to keep me occupied in my isolation. Video chats with family have lost its novelty as this pandemic dragged on, increasing my isolation. So I've found ways through social media, letter writing, and phone calls to stay connected.
And Ron is very fortunate too, right? Because it sounds like he has the capacity to be active within his own environment, and he also has access to the internet and a device. We need to be aware that there are some seniors that are isolated without the opportunity for a video chat or without the opportunity to connect via social media or other platforms. So I think that's great for Ron and excellent advice. The meditation is terrific. The journaling's fantastic. And everybody can do that. But there are some folks, I just think it's important to note that there are some folks, everyone here, of course, has access to the internet and is connected to a device. But for those who don't, it might be an extra layer of isolation. And that maybe if we could be mindful of that as we're interacting with others. You know, not all of us had the benefit of video chats for a year and a half.
That's right. And that's where the Counselling Center of East Algoma comes in, because you have a number of services and you're available through various media to you're available by phone, you have in-person counseling sessions. We'll speak about all of those, but perhaps we will start with the most the type of service that you offer for crisis situations, and then we'll come down to the general counseling. So you have a special service called the crisis response service. In what circumstances would someone access? Is that service geared for?
So we have decided quite some time ago that we're not going to tell you if you're in crisis. So we feel strongly that you determine if you're in crisis. So on any given day, any of us can feel like we've just, you know, that's the straw that broke the camel's back and I'm fed up. So you can just call our office, 705-848-2585, and request to speak to the crisis worker. You can also walk in to either our Elliott Lake or Blind River office and have the same opportunity to speak with someone in person. So yeah, we don't, our crisis service is a Monday to Friday, 8:30 to 4:30. At 4:30, there's a mobile crisis team locally that is run out of Sioux Area Hospital. And if you call our number, that number I gave you just a minute ago, and it's after hours, our answering machine will pick up. And one of the first things it will say is, if this is a crisis, press 1. And if you hit that 1, you will be automatically dispatched to the Sioux Hospital. So you don't have to worry about remembering times and who's open when. We try to make that simple for folks. So if ours is a number that you get used to, feel free to use it even outside of our hours, because it can link you to other services that are available.
Tell me a bit more about that. You say the crisis, you don't define crisis.
No, we don't. There was a time when there was a perception that you had to have a mental illness before you could access crisis service, or that it was only for certain types of crisis. But we have decided that, you know, the crisis today may be that I lost my wallet. It may be that I lost my spouse. So you will get equal access to high quality service regardless. There's no judgment from us about, if you feel you're in crisis, you are in crisis, and we will make sure there is someone who's available to talk to you.
Okay, wonderful. So that can be either accessing the service by phone, or someone can come to the office, and this is at Oakland Boulevard, the address.
Yeah. We are in the Oak Center, which is the large building just down from the Esso. Our entrance, there's a few different services within this building, but our entrance is what appears to be the main entrance of the building. It's got a canopy facing towards the plaza that has the Fireside in it and the Moose Lodge, or just across from the Moose Lodge. So if you walk in under that canopy, you're walking right into our space.
Great. And for those in Blind River?
We are at 1 Industrial Park Road. Again, it's a lovely building across from the OPP station on the highway. Second floor, Suite 210. There's quite a bit of signage. You wouldn't get lost on the second floor there. You would be able to see us. The other thing that we do from time to time is we will send our staff out. Sometimes we've gone to schools, we've gone to hospitals. If we have to, we will go to a person's home if it's safe to do so. So we really try to make it easy for people to access the supports they need in the setting that's most available to them.
Okay, very good. And so that's the first service that we look at, the crisis response service. Anyone who feels that this is a situation I can't handle, I am really in need of support at this moment, I need to speak with someone to help me back down from where I am at. The Counselling Center of East Algoma is there for you 24 hours, 7 days a week.
Well, you're not going to get one of our staff 24/7. So we are Monday to Friday, 8:30 to 4:30. And during those hours, you will always get a person answering the phone. If it's outside of those hours, you'll hear our voicemail message, and that will link you to the mobile crisis team if need be. There's also a link to the warm line, and the warm line is a peer support. So some people will just want to talk to someone who's maybe in a similar situation. So if you don't really feel like you're in crisis, but you do think you could benefit from a chat with someone, the warm line is also an option. And I believe that's number 2 on our voicemail system. And then in terms of the after hours crisis on evenings and weekends, it's not 24/7, but it's tailored to the times where their calls are most frequent.
Is that information easily available, readily at hand?
So it is 1-800-721-0077.
And that's available on the weekends?
So that would be weekdays, 4:30 till 11 or midnight, I believe. And weekends, I should know this, Celia, I'm sorry. Weekends, I think it's 10 till 10 or noon till 10 or something like that. The other thing, though, is if you're not getting a call out, so if people aren't coming to deal with you in person in crisis, the folks will manage it over the phone. So it's a good service.
Okay, so we have another question from the audience, and that's whether police would be involved when someone calls in with a crisis. There may have been other cases where someone was in crisis and the police made the situation worse. We have mention of an incident where the police handcuffed an individual during a crisis.
So that's a great question. Sometimes when so we don't typically call the police. We would only ever call the police if there was a threat to one of our staff or an individual. So we would not call the police through the crisis program typically. But if a call comes in and the police do respond, so the police respond to 911 calls. Depending what they encounter when they arrive, if someone, there are situations where individuals in crisis need to be taken to the hospital for a full assessment. If the individual is not willing to go, and if they're presenting a threat to themselves or someone else, that might be when the police would get involved in the way that was described. But we actually have started a program with the OPP in the last, well, it's not quite a year yet. It's called the Mobile Crisis Rapid Response Team. And what it is we have a social worker working out of the OPP station so that when those 911 calls come in now that aren't criminal in nature, so it could be things like neighbor disputes or it could be anything. If it's not criminal in nature, if it's not a dangerous situation, the officers will take our social worker with them in hopes that our clinician will de-escalate the crisis and connect that individual with services locally so that there is less need to reach out to the police or use the hospital. So I'm hoping, Ron, that we're making some headway there. Time will tell.
So just to clarify, from what you're saying, the crisis line that we spoke about, that is totally separate from the situations where the OPP gets involved. That's when someone calls to 911. That's where the OPP gets involved, and what's nice is that there is a new collaboration between the Counselling Center of East Algoma and the East Algoma OPP, where there's a new approach through that collaboration of handling a crisis situation in that way. But that's a separate service to what we were talking about earlier in terms of, yes, and people can take comfort in that if you call the number that we had mentioned here, you will be dealing with a counselor from East Algoma, the Counselling Center, and it's not, that's not, you don't need to worry so much that it's going to the OPP. This number is for someone who will help you through a crisis.
And anytime we're working with someone, we explain all of the conditions of confidentiality. We explain when we can't maintain confidentiality. Yes, our work is not with the OPP unless they've requested our assistance.
Okay, so we do have further comments from Ron, and that's that unfortunately the individual who had a crisis and had been handcuffed was reluctant to call the crisis line the next time, and unfortunately committed suicide. So, really tragic situation there, Shelley.
Absolutely, that's awful, and I'm so hopeful that the approach that the OPP are taking now and the partnership they have with us will reduce those kinds of responses. A lot of people have very negative experiences with police. I'm happy to report that I'm seeing a lot of positive change with our officers here. They're getting additional training in mental health. They're recognizing that sometimes their presence in a situation and their uniforms and their guns can be triggering for individuals based on their own past histories and other things. And I think the OPP are really moving in the right direction in terms of the training the officers are receiving and the programs that we've instituted just last August. So I'm hopeful that moving forward, the type of situation that was just described doesn't happen as often, but individuals will make the choice to take their life from time to time for a whole host of reasons. And the best we can do is try to offer them supports when the opportunity presents itself, in hopes that they will gravitate to something that is helpful and not look at that as the only option.
Yes, thank you for that, and thank you for the input, Ron. Okay, moving on to the services that the Counselling Center provides. You also have services for those who have experienced violence in their domestic situation. Tell us about that.
So we do have a program that works with women specifically who have experienced abuse in their intimate relationships. It could be current or it could be historical. And that program works with individuals, and we also have group programming within that program when COVID protocols allow for such. And yeah, it's really working with women to help identify risk factors for abuse, what abuse is, safety planning. Yeah, it's a very great program, and this is not to say that men can never be abused in their relationship. The funding we receive within the program that you're referring to is specific to females though. But if we became aware of a man who was experiencing abuse in his relationship, we would just deal with him through a different format.
And there's also a program for the abusers?
Yeah, our partner assault response program is geared to perpetrators of intimate partner violence. It is almost always offered in group format, and most of the folks that are attending that program are doing so because they've been mandated either through a probation order or an early intervention order. So we do accept voluntary folks in that program, but I will be honest, most of our referrals for that program are mandated. Every so often we do have some folks who say, I'm really not comfortable with the way I've been behaving towards my partner, and they will join that program voluntarily, but the majority of the referrals are mandated.
You also have services for survivors of sexual assault. That's a different program, is it?
Yes, actually it is. So, well, as we're talking, I'm realizing how many folks we see who have a multitude of issues. So oftentimes people who have a history of sexual assault will then find themselves in abusive relationships and sometimes cope through drinking or drug use. So we try to recognize that many of the issues we deal with, addictions for instance, are symptoms of another problem. So while we work with folks to get their addictions under control, we also recognize that sometimes the drinking or the drug use is a coping strategy to deal with the other issue. So our sexual assault program, we have two specific programs recognizing that both men and women can be sexually assaulted. So the sexual assault program, again, works in individual or group format, and that's for both men and women. Typically, we're working with historical sexual abuse, but we also will work with recent sexual assault. So our partnership with the OPP actually is giving us a little quicker access to victims of sexual assault so that we can help them in that moment of crisis, and then also support them and provide counseling and treatment as they begin to heal from that trauma.
Tell me a bit more about your services for those with addictions.
So our addiction program starts working with individuals as young as 12 years old. And that doesn't mean that, so within the addiction program, again, we can work with you individually or in group format. Most of the work within the addiction program is individual work, meaning people come in and they will identify what their goal is. So some people will tell us that they absolutely need to quit whatever substance they're using. Others will tell us that they just want to reduce their use. And sometimes within the addiction program, we're working with individuals who are affected by somebody else's use. So you don't have to be a problematic user to be within the addiction program. Sometimes it's learning to cope with the behaviors of an addicted person that you happen to love, or who's your child or your grandchild.
And the final area we're looking at is your general counseling. That's available to whom, and how can someone access that service?
So the general counseling program is like all of our programs. So we do not need a doctor's referral. If you feel like you could benefit from the support of a counselor, you just have to call and say that. I would like to get set up with a counselor, and we will set you up with an intake. We'll try to get a really good sense of what you're looking for, and then we will do our best to match you with a clinician that's going to work well with you. I always let people know that if they meet their counselor and it's not quite clicking for them, all they have to do is let us know and we will switch them to another worker. So the only caveat to that is that I also ask people to think about, am I not talking about what I need to talk about because I'm not comfortable, or am I actually uncomfortable because I'm doing the work that I need to do? So sometimes the counselor challenges you to go to difficult places. They may be the absolute right counselor for you. So you just have to weigh that out. But if you find that you're not talking or you're not feeling comfortable with the person you're working with, we will work to get you a better match. So I always put that out there for folks, because sometimes if they don't hit it off with their worker right off the bat, they don't ever want to come back. We're usually pretty good at getting it right the first time, but if we miss the mark, please let us know and we'll try to get it right. So once you've completed your intake, the general program really just speaks to issues that don't fit into the other programs that we've talked about. So people in the general program might be dealing with things like marital issues. Maybe they have some mild to moderate anxiety or depression. Maybe they are dealing with grief and loss. Maybe they've had a health situation and their health status has changed. So they're having to adjust to, maybe I've been an avid hiker my whole life and now I lost part of my leg because my diabetes was not under control. So we will work with helping them adjust to their new reality. Sometimes it's around job loss, sometimes it's around workplace stress. So basically the general program is just our catch-all for those things that didn't fit into another program. So what's really lovely about the Counseling Center of East Algoma is that for most people with most issues, we can help you out. If you come through our door or if you call us for service and we find out that you're looking for something that we don't do, we will work with you and we will wait with you until you get to the service that you're looking for. So I try to explain it. If you're not looking for a children's service, if you're not looking to diagnose or treat a serious mental illness, we're probably going to be it for you.
That sounds wonderful. And now we come to close to my final question, but a very, very important question, and it's one that will always come up whenever anyone is seeking services. It sounds very expensive. How much does it all cost?
It's nothing. So actually there are no services whatsoever for any of our programs. We do receive funding from different ministries of the provincial government to offer all that we do. I shouldn't say there are no costs. Sometimes if we're offering a group, there may be a minimal charge to provide you with a photocopy of a manual or some sort of resource you might need. But for you to access our service, there is absolutely no charge, and we do not have a wait list. So for most people calling, once you've done your intake, there really shouldn't be too much of a lag before you get in to see your clinician, because it would just be a matter of lining up your schedule with when your counselor has an appointment. So that's excellent news. People are usually super excited when they hear about that. And I've been affiliated with the agency for 25 years, and as long as I've known, we've never had a wait list and we've never had costs for service. So we can be very fortunate in this area to have access to that.
That is wonderful. So, we can, in Elliott Lake, Blind River, receive the care that we need, the supports that we need when we are in a situation where we realize that, we need to reach out, and there's no cost as a barrier to accessing those services. That's wonderful. So as we close off, I'll ask you to share with us once again how seniors in Elliott Lake can get in touch with you and have access to these wonderful free services.
Absolutely. If you have any questions or concerns, if you're interested in service, if you wonder if we're the right place for you, just give us a call, 705-848-2585.
Great. Thank you very much, Shelley. So those were the areas that we wanted to cover based on the feedback from seniors prior to our discussion today. Is there anything that we haven't covered over the last few minutes that you'd like to share with seniors in our community as we close?
Maybe I'll just mention 2 additional programs that we've started just in the last, we're in June now, so probably in the last 3 months. One of them is related to the program I spoke about that works with the OPP. So we now have a worker and doing transitional case management. So when somebody has made contact with our social worker through an outreach with the OPP, a referral will be made to our transitional case manager with that individual's permission, and then the transitional case manager will work with them to try and address some of the things that might have resulted in the call to the OPP. So it could be things like helping them find housing, it could be making sure they have the financial support they need, it could be linking them to a psychiatrist or, a service like ours. So that's one additional program. And the other thing we've started in the last 3 months is we have hired 2 community support workers. And these are people that I like to call doers, because they are sort of available to do those things that nobody else is doing. And by that I mean, again, it could be helping individuals find housing. It could be helping them get linked to technology if they want to visit their family who might be in BC. And again, if you think you could benefit from a community support worker checking in with you or helping you with access a service possibly, or some advocacy that you might need within the community, again, you just call our office, 705-848-2585, and we will, through the intake process, help determine what is the best service we have to offer to you.
That sounds great. So no one should feel isolated, alone, and unable to access services. They can reach out to you, and you can go through and assess their needs, and the community service worker or any of your staff will be able to help any of our seniors in our community look at their situation and see how we can bring solutions to make life better for them in their golden years.
That's certainly our intention, and if it's not a service that we can offer, we will do our best to get you to the service.
That's wonderful. Thank you so much, Shelley, for providing, I would say, hope. That's what I get from our discussion today. There's hope no matter what the situation someone may be going through, no matter what the pandemic has brought. There are ways to navigate out of those situations. There are people here, experts who can help, and it's all available to our seniors just one phone call away. Thank you so much for sharing that hope with us, and we will share it with seniors through the Golden Voices, Golden Years Fireside chats. Thank you as well for our online audience. It's always great to have you with us. Thank you once again for being here.
Thank you so much. Thank you. I really appreciated the opportunity.
Great. Thank you so much, and have a wonderful day.